Hello and welcome to our August Purple Chair Chat. My name's Larissa Whitney and I'm an Education and Prevention Specialist here at Jana's Campaign.
And I'm Susanna Schneider, and I'm a Fort Hays State University intern for Jana's campaign.
During this chat, we will discuss the effectiveness of bystander intervention as a prevention method. Our intention is to highlight this preventative tool as a way for you to intervene in situations such as bullying, suicide ideation or attempts, and drug and alcohol abuse.
Purple Chair Chats are live conversation instilling the knowledge, skills, and values necessary to prevent gender and relationship violence. We use these discussions to raise awareness, engage bystanders, promote healthy and respectful relationships, and encourage the development of new social norms.
And when we talk about bystander intervention today, we will use the term active bystander. More on that in a moment. Before we get started, let's make sure this is a space where we all feel safe, respected, and comfortable participating. A disclaimer that we will be discussing some sensitive topics regarding gender and relationship violence, and it may be activating, so please do whatever you need to do to take care of yourself.
If you are in need of resources or services and you do not know who your local advocates are, reach out to us and we will do our best to put you in contact with the right people. We will link in the chat resources for youth and adults that help provide education and safe spaces.
So Suze, can we start by what is a bystander?
Bystanders are individuals who witness concerning behaviors, problematic events, or emergencies, and by their presence have the opportunity to provide assistance, do nothing, or help facilitate the negative behavior.
And as I was saying, an active bystander is what we'll use today to refer to an individual who intervenes in a way that impacts the outcomes positively. So where did bystander intervention originate?
Social psychologists popularized the concept of the bystander effect following the infamous murder of Kenny Genovese in New York City in 1964. The 28-year-old woman was stabbed to death outside her apartment, and at the time that it was reported, dozens of neighbors failed to step in to assist or call the police. The term itself has since become common among researchers as in popular discussion of such incidents. Psychologically, the bystander effect is often attributed to people being influenced by the inactions of others around them, or to what psychologists call diffusion of responsibility, which refers to a phenomenon in which people feel less personally responsibility when there are more people around them. It is mainly discussed in the context of emergencies and cases involving violent crime. For example, the bystander effect is commonly cited as a reason for bystander inaction during instances of sexual assault.
Can you also explain, I heard you say bystander effect. Can you explain that concept?
The bystander effect occurs when the presence of others discourages an individual from intervening in an emergency situation against a bully or during an assault or any other crime. The greater the number of bystanders, the less likely it is for any of them to provide help to a person in distress. People are more likely to take action in crisis when there are few or no other witnesses present.
Interesting. So our audience might be wondering, what steps can I take during a situation? So I'll take us through those. Step one is to recognize that something is happening or has happened. Step two would be to identify possible barriers, determine how to intervene safely. These two steps sound familiar to me because I just went through a first aid training, and when you approach a situation, they say to do the same two steps to recognize and identify how to help safely. Step three, though, is actually intervening with others and taking action when it's specific to bystander intervention. There are three types of possible barriers to intervening. So we have personal, peer, and societal barriers. Personal barriers might be a lack of confidence, personal safety, fear of getting in trouble. Peer barriers could be the fear of embarrassment, the threat of retaliation. Being a former third grade teacher, The fear of being a snitch was a huge issue whenever even little young third graders would have to step in as a bystander. And then on a deeper level, there are societal barriers, diffusion of responsibility, recognition apprehension. So yeah, there's just a few examples of some of the barriers, but there are many more.
Right. Here at Jana's campaign, we're encouraging others to be active bystanders. Each of us have different leadership skills or personalities, and we're going to intervene in different ways. Some of you may know the 3 Ds, which are direct, and that is to say or do something immediately, delegate, which is bring others into help, and distract, which is to diffuse the situation without directly addressing it, whether that be the next day or after the fact. And then lastly, there's protocol, which is just logical thinking, such as the rules or the laws.
Yeah. I was actually talking with a friend yesterday. Crazy how that happens when you're about to do a presentation or a speaking engagement and something happens the day before. I'm going to talk about that tomorrow on the Purple Chair Chat. She was a former teacher and was explaining a situation. We weren't even talking about bystander intervention, but she was explaining a situation with a student she wished she could have done differently, and she said, I don't even know how I would have responded. She told me about the situation, and I was able to share with her the 3 Ds and help her determine, based on her personality, how she would have responded. And we ended up deciding that distraction probably would have been the best step. So I really like the 3 Ds. I think that's probably my favorite part about the bystander intervention, and I've learned a lot. I certainly think of a lot of situations I could have used those 3 in, and it's definitely going to help in the future. You always want to remember to keep yourself safe and ask yourself, what are all of your options? Are there others that you can call on for help? Which brings us to step 4, following up and determining what support and or accountability is needed. You always want to say something, whether it's to a trusted friend or an adult. Maybe it's talking to a pastor or a trusted member of your church, or contacting a local domestic violence agency. There's also the National Domestic Violence Helpline at 1-800-799-SAFE. And then, of course, if it's an emergency, call 911. Also wanted to add, if a friend confides in you, to make sure you believe them, ask them how you can help, and then with their permission, you can also contact your local domestic violence agency.
Yep. Thank you for joining this month's Purple Chair Chat. We hope you were able to learn something today that maybe you didn't already know before. And as always, if you're in need of resources or services and you do not know who your local advocates are, reach out to us and we will do our best to put you in contact with the right people.
And Suze doesn't know I'm about to say this. Surprise! But I'd like to add one more thing. Today is Suze's last day at Jana's campaign. Would like to wish her the best as she embarks on her new chapter in her career. And I wanted to take a moment to express my sincere gratitude for the time we've spent working together. This is our 3rd Purple Chair Chat. And your dedication, professionalism, and positive spirit have made a positive impact here at Jana's campaign. So
thank you.
You will be missed, and we wish you the best.
Thank you. I loved being here, and I feel like I learned a lot, and helping others know what I learned here and just getting it out in the public and making sure everybody knows that this is a issue and this is a way to spread the news and make sure everybody is aware of the situations that happen. So thank you so much.
Of course. Thanks, everyone.